whatever we're choosing to do, whatever level of quote-unquote cleanliness we're going for, we have to keep in mind that microbes, well, not everything you're going to be using, short of flat-out sterilization, autoclave, or some sort of high-pressure, high-heat environment. Short of doing that, autoclaving everything, whatever mechanism to use for decontamination, antisepsis, and whatnot, there are going to be microbes that are resistant to whatever it is you're using. Think about it. Most of the advertisements you see for certain soaps or certain detergents kills 99.9% of blah, blah, blah. Well, that 1 in 10,000th microbe that doesn't get killed is resistant. Now, it turns out, if you look at this graph here, this table, that some of the microbes that we will come in contact with throughout our life are just inherently more resistant to all the things that we're going to be doing. Down at the bottom, you'll see at the least resistant are enveloped viruses. Damage the envelope, virus is no longer infective. As you move up, you'll start to see protozoan cysts, staphylococcus, mycobacterium. And at the top, bacterial endospores and prions. Remember those proteinaceous infectious agents we talked about, mad cow disease thing? Those are pretty much almost indestructible. So as we're looking at this relative resistance, we're going to find throughout this chapter you have to take this into account when you're in a clinical setting and you're trying to determine what levels of clean are going to be required in a given medical environment. What potential microbes may be there that you will have to deal with. So when you look at these different mechanisms, take into account that not everything is fast, not everything is foolproof. You look here at table 9.2, looking at bacterial endospores versus the vegetative bacterial cells. Just heating something up takes 120 degrees Celsius. That's what, almost 300 degrees Fahrenheit? Or no, wait. 250 degrees Fahrenheit to kill or damage a bacterial endospore. Radiation, the dose, 4,000 or 4 times more than what it would take to damage and kill a vegetative cell. Gas, going to have to almost double. Glutaraldehyde, which is a chemically close cousin to stuff that we use for embalming. 3 hours you have to soak something if you want to damage and destroy the endospores. These are the things that in a clinical setting you have to take into account. Nothing's fast, nothing's foolproof. You see people go in restaurant settings, or you see them nowadays with the COVID and everything. They come in, they spray a table, and they immediately start to wipe. Well, based on table 9.2, do you think the spray and the wipe, spray with one hand, wiping with the other, do you think that's enough